Hello everyone, welcome to Physiotherapy in Lesotho, www.physioinlesotho.ch. You are listening to a podcast from one of our physio workshop in Lesotho. Your speaker is Thuso, W. Fasser, a qualified physiotherapist.
Natural remedies. Natural remedies are drugs which we made by plants. So these are medicines, natural medicines made by plants. And we make them in a pharmaceutical controlled way. So then we call it natural remedies. When we talk about natural medicine, it's that way of doing medicine, using herbs and flowers in a pharmaceutical controlled manner. This is very important. You know, there are people, they just invent themselves using herbs and roots and things, and they do recipe, and then people end up poisoned. I'm not talking about that. I'm talking about a proper use of herbs in a pharmaceutical controlled way as our medicine, the pain tablet or the antibiotics are controlled. The same way we can work with the herbs. So what we use in physiotherapy and what we quite often explain to the patient is the use of local herbs. So we have some herbs which grow around our houses and they can be helpful. We were talking about respiratory physiotherapy, people with problem on the chest, upper airway. We have very helpful herbs just around the house, which people can use for steam inhalation, or they use it in a way you make an oil, or we can use it as a tea. There are two of the herbs we know very good here. One is quena, the mint, the wild mint, quena. I think all of you know what is quena, okay? Mm-hmm. And you know where it is growing. Mm-hmm. Where does it grow? Yes, sometimes there on the stream, on a wet place, or there is that other type of quena, the very aromatic one, on the dry places. So peppermint, it's called, or wild mint, or quena Lesotho, and there's quena Lesotho. There are two of this type of quena we find here. That domestic mint is a more cultivated mint. It's maybe, the flavor is a bit more, you like it more. It's less archaic. But both of these plants are very helpful plants. These are really medicines. Now, we can use quena as a tea. We just do a slight tea and we drink that. That will help to loosen the bronchi, to relax the bronchi. So in bronchitis, in asthma, or after TB, it will help to dilate the bronchi. If you use that tea, you can as well relax your intestine, or if you have some gastritis, a nervous stomach, it will help you. Quena is dilating, is just relaxing the visceral muscle. Therefore, if you have spasm in the bronchi, or spasm in the intestine, or premenstrual pain, you can drink quena tea. It will help to relax the visceral muscles. But the main action of quena is to dilate, to relax the bronchi. So we can use it as a tea, or you use it as a steam inhalation, a pot of water, you put a handful of these leaves in it, that boiling water, you cover yourself with a blanket, you do like a little tent, and you breathe in and out this moistest air with that quena, and it will help to dilate the bronchi. It's very helpful. You can have just this pot in your house. There is a bit of boiling water. We are careful that the children are not putting it down. And that steam is going to the room. You will breathe it in and it will open up your bronchi. That is a good help next to the antibiotics maybe the patient has or whatever. We don't do that instead of the medicine. We do it together with the medicine the patient gets. Another herb which we can use for respiratory problem is that Bolecum tree. We just take the leaves and we put it in the pillowcase. So patient is sleep during the night on that pillow with these leaves. It's a bunch of leaves. And smells, breathes in and out this air, and it will dilate the bronchi. And it has even a disinfective effect. We can use it as well just to have a pot of hot water. We boil it in the room, and that moisture which is going in there, that air from eucalyptus, from Bolecum, will help to the bronchial breathing. We use it as well as a massage oil. We can prepare an oil with it. But for our respiratory patient, it will be perfect to use it as a steam inhalation or in the pillowcase. So we have already 2 herbs which are growing around our houses and we can use to sustain the treatments. So there are many of these herbs. We cannot tackle now this. Maybe in our next workshop, when we do the second level, next year, we will tackle that. But I just give you some name of herbs which we can use easily. So it's quena, we said. It's pefo. You know it. Old people, they use it. We use Lengana lasochoa and Lengana lasosot. Lengana, everybody knows. It's that very strong herb. We use it for washing ourselves and for steam inhalation. To drink it, it's very strong. Be careful drinking it. And then there is that Artemisia Lengana lasochoa. It's a very potent medicinal plant which helps to boost up the immune system. Therefore, it's given in cases with malaria or HIV patient. We have some of these plants. We will do baby plants now. Every year you have to redo that plant and then you're drinking this tea. It can be used as well when a flu is coming. We have the Lachala lataba, aloe, Lachala lataba. Here. You know it. There we take the leaves, we cut them, and that gel which is in it, we put on the painful joints. For drinking or eating, there are many recipes, but let us be careful. The recipe is very precise, otherwise it can become poison. Aloe is a medicinal plant, but it has to be used in a proper way, like an antibiotic. It cannot be used like this, otherwise we can poison the people. So therefore, let's be safe. We give it to the patient only for external use, so you are safe. Let's be safe. Let's be attentive with these herbs, so you can do very good with it. So, Lataba we have, Guene we have, Lengana we have, then we have Lefocozzane, the wild fennel. You know it. Lefocozzane, wild fennel. It's growing all over. It's high like this. You use the seeds, but even the leaves. We can make a tea of it, and it will help the breastfeeding mother because it will give more milk. If they drink that tea, they will have more milk. Isn't that great? It's so important. And another thing, you will digest fat much better. So if you have a fatty meal and you drink a cup of that tea, you will feel easier. And if you suffer of having too much air in the belly and you drink that tea, it will help you. So we use that wild fennel. And then there is another plant there, sage. And Teresa will show you then. The sage is a wonderful plant we can use for inflammation, for sitting baths, as these flowers here. And for the gargarism, if you have an inflamed throat, things like this, we use that. There are many of these plants And when we will do the next course, we will introduce to them that you can teach the patient how to use them in a safe and proper way to help them to heal. When we do the practical on crutches, I will do it in 2 groups. So one group will be accompanied by me, Teresa, to the medicinal garden where you can look at these herbs, and she's just showing you, just to get an idea. Okay, do you know other herbs which you were using, or your family or your grandmother was using at home? What else? Give me a name of this herb. Guenia? Guenia, like yesterday. Yes? Guenia? Hape? Uh-huh. There are many, isn't it? No. Okay. What we have to be aware, whenever roots are involved, we have to be very careful. Roots are difficult to distinguish one from another. Roots can be very poison. So I never buy a root from somebody because we never really know, is it or is it not? We never know how dense it is or not. So therefore, when you go to Maseru and you have the marketplace and there is that Ntate who is selling Meriana, he sells a lot of roots. You don't know really which root is which, because sometimes they look very similar, but they can be very poison. So therefore, I say don't work with roots, so you are safe. I remember last year there was a case, it was a little baby, that baby maybe 2 months old, she had a bit difficulty with, she was obsticated, so they gave her medicine made by roots, liquid medicine. It was just a liquid medicine made by roots. So nobody knew what root it was. That little child was so poisoned, it was so yellowish, we couldn't find out what it was. It was not possible to do something against it. It was just by root. And that poor girl died after 2 days. So roots can be very dangerous. Don't buy roots from anybody. And don't work with roots with patients, so you will be safe. Using roots, you have really to know it well. You have to know the dosage perfectly, and it's difficult, it's dangerous to work with roots. Therefore, keep yourself in a safe place. Don't work with roots. We know roots can be very potent and helpful, but hands off, you are on the safe side like this. So it's better. We use leaves and we use the flowers, we use these herbs which are not dangerous but helpful. So we keep ourselves on the same side when we teach the patient to help themselves with the local herbs they have.